The body has two basic sets of controls to regulate energy intake. The first of those are what we call episodic, and those are the meal-by-meal mechanisms. The signals generated through the act of consumption and after the act of consumption, signals from the mouth, signals from the stomach, the small intestine and the large intestine, which all serve to feed back to the brain, bring a meal to its end and inhibit further food intake. Then there are the tonic mechanisms. These are the metabolic signals which come from fat tissue, which inform the brain of energy being laid down for storage, which also feed back to the same hypothalamic mechanisms involved in homeostatic regulation. All these signals are integrated there. Now, normally these can adequately manage our appetite regulation, although foodstuffs which are very, very energy dense have less impact on them. But what we find as people's body weight is increasing and as they're over-consuming, actually those mechanisms start operating suboptimally. So the within meal mechanisms, what we find is we get reduced basal levels of satiety hormones, so they are lower levels anyway, and their response to food intake is blunted. So there's lower levels and their response is smaller. For the tonic mechanisms, what we find is there's actually an increase in the signal. There's more leptin produced from the fat tissue to tell the brain there's a lot of fat reserves, there's a lot of energy in storage. However, the brain becomes resistant to those signals. So here, the signal is being ignored. Now, in that situation, those homeostatic regulatory mechanisms in the brain are weaker. And there, in that situation, the hedonically driven food intake becomes the more predominant controller of food intake. And that means people are more responsive to external food cues than they are to their internal appetite. And that's why consumption doesn't turn off that responsiveness in the same way it does in lean people. On one level, the proposition, which is the energy balance equation, is very useful in understanding both the causes of obesity and how to treat obesity. The problem with the energy balance equation, energy in, energy out, is it assumes that those behavioural changes in terms of controlling appetite and increasing activity are very, very easy. In fact, behaviour is the result of lifelong learning and reinforcement, and changing those behaviours is quite difficult. And when we understand the energy balance equation in the context of individual psychology and also the biology of energy regulation, we can see that changing people's food choices and changing people's active behaviour is a little bit more difficult. And these things in turn are shaped on a population level by the food environment, the social cultural environment, and also the physical, the built environment that individuals operate in. And this is why the energy balance equation is important, but it also deludes us that the obesity problem is more tractable than it actually is. The marketing of junk food is a very hot topic issue. In the UK, we've had regulation to control the amount of foods which are high fat, salt and sugar shown during child-specific programming. But one of the problems is that only is a very small part of actually children's viewing behaviour. Actually, they're watching family and a broader range of commercial television viewing as well. What we do know is children are influenced by advertising without the need to understand what advertising is, but actually education advertising doesn't seem to have all that much effect on their eating behaviour either. Now, TV advertising has been under some regulatory control, but obviously TV advertising is one small part of the overall branding package, and we know advertising in particular is a problem. Advertising is a problem because children immerse themselves in the brand for 30 minutes, 60 minutes, beyond. They're rewarded for participating through game scores. They encourage their friends to be involved through social media, and you can see all of these marketing techniques are reinforcing the brand. That would not be so bad if these brands weren't associated with high fat, salt and or sugar. And what we see is they are focusing children on an area of their diet which actually, in terms of public health, we're trying to move them away from. And what we do know is when we show these children these adverts, when we have them on the advert games, what we see is a change towards high fat, salt, sugar consumption.